Welcome to the Brownville Memorial Hospital Health Literacy Training Session. I am Sarah Tackett, Director of Performance Improvement. What is health literacy? Health literacy is a person who is capable of acquiring, reading, comprehending, and using health information to make the proper health decisions and follow treatment instructions. Two areas of health literacy that we can improve on and will be focusing on in this training are language and cultural differences and encouraging patients to ask questions. Understanding health literacy is important, especially when dealing with patients with language and cultural barriers. Language and cultural barriers can make it hard for effective communication or comprehension between provider and patient. When effective communication is absent, errors can occur. The patient's safety is at risk and the quality of care is poor. This graph shows the percentage of adult population groups and their literacy skills at National Adult Literacy Survey levels. Level 1, adults can read uncomplicated text or generally locate a piece of information on a form, such as a social security card. Level 2, adults are generally able to find information on a document and integrate easy-to-identify information. Levels 3 to 4, adults can comprehend information in long or dense texts or documents. As you can see, immigrants scored the highest at level 1 with 60%. Only 9% of immigrants were at a level 3 or 4. Next, it is important to encourage your patients to ask questions. This simple task can increase patient satisfaction, lower the number of callbacks from patients, promotes better health outcomes, and helps make patients feel they are included. This is the health literacy framework. This figure shows that literacy is the basis for health literacy, and health literacy is the mediator between individuals and health contexts. There are a few policies and programs available to improve health literacy. Two that I think are important for this training are the National Action Plan to Improve Health Literacy and the National Standards for Culturally and Linguistically Appropriate Services in Health and Health Care. The National Action Plan seeks to engage organizations, professionals, policymakers, communities, individuals, and families in a linked multi-sector effort to improve health literacy. The two core principles are all people have the right to health information that helps them make informed decisions, and health services should be delivered in ways that are easy to understand and that improve health, longevity, and quality of life. The national CLAS standards provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. Language and cultural barriers are a common issue in health literacy. English is a second language to 55 million people in the U.S. As health professionals, we are responsible for connecting communication gaps with patients from different countries or speak a language other than English. Ways to do this are to make the patient feel welcome, use an interpreter or translator, ask who makes the decisions for their family, because in some cultures, only a man or the head of the household can make the decisions. Avoid complex medical words and encourage questions. How can we encourage questions? Remember, patients may feel overwhelmed by the information given to them or may feel scared their question may be stupid. Make sure to encourage questions. There are no stupid questions. Use open-ended phrases. Reassure patients they can ask any questions that they might have. Ask questions as well. Prepare common questions that are asked by other patients. Tell the patient to write down questions. This will help them remember what questions they may have had. Language practices that need to be avoided. Jargon, such as the exam was unremarkable. Instead, say the exam was normal. Abbreviations, for example. I'm going to take your BP. Instead, say blood pressure. Complex medical terms, such as oncology or nephrology. Instead, use the terms cancer or kidney doctor. Last, avoid yes or no questions. Instead, use show me or tell me questions. For example, how will you take your blood pressure? Suggestions for the best language practices to use are: first, the teach-back technique. It is a great way to improve health literacy. It involves asking patients to recall and explain or show the information that was talked about during their visit. Also, it's a good to remember to use plain language. Plain language is a communication designed to meet the needs of the intended audience so people can understand information that is important. With plain language, focus on key points. Use common 1 to 2 word syllables and have a friendly, engaging tone. Also, speak slow, encourage questions, and show and give examples when needed. Next, we are going to use what we have learned in this training session. We are going to do a group role-playing exercise. This small group exercise will focus on language and cultural barriers and encourage patients to ask questions. There is a handout that provides instructions for each role and a checklist for the observer. There will be 3 roles: health professional, patient, and observer. There are also 3 rounds, and everyone will switch roles. The observer will give feedback to the health professional. Each round will be 5 minutes long. At this time, I will give the groups 20 minutes to perform their role-playing exercise. This is the expectations I have from each role. The health employee. Use the teach-back technique and use clear and simple language. Ask open-ended questions. Provide help for patients with language and cultural barriers, such as offering an interpreter or translator. Next, the patient. The primary language for the patient will be Spanish. You're having trouble understanding your doctor. Ask questions about the instructions given to you. The observer. Watch the interaction between doctor and patient carefully. Is the doctor using the health communication techniques that were discussed? Rate the communication skills on the checklist provided. At the end of the exercise, we will go over the observer's notes and focus on things people notice the most that needs improvement. What I would like to see is the use of clear communication, utilizing the teach-back method, using visualizations such as materials patients can bring home, be aware of language or cultural barriers and find a solution, and encouraging questions. At the end of the exercise, we will report back and everyone we'll review the observer's notes. Thank you for your participation during this training session. I hope you utilize what you have learned today throughout your career and help improve the health and health literacy of others.